In this lecture, we turn to libertarian justice, a theory of justice that emphasizes individual liberty, property rights, and freedom of choice. While distributive justice asks how resources should be allocated, procedural justice asks whether decision-making processes are fair, and restorative justice asks how harm can be repaired. Libertarian justice asks a fundamentally different question. What does justice require when individuals are free to choose, contract, and exchange without interference? Libertarian justice prioritizes individual freedom over patterned or outcome-based notions of fairness. It is less concerned with equality of results and more concerned with respecting voluntary choices and protecting rights. At its core, libertarian justice is grounded in the moral importance of self-ownership. Individuals are seen as owning themselves, their labor, and the fruits of that labor. From this perspective, justice requires protecting individuals from coercion, fraud, and forced redistribution. Libertarian justice holds that as long as exchanges are voluntary and informed, the resulting distribution, no matter how unequal, is morally acceptable. This view stands in contrast to egalitarian or need-based approaches, which often justify redistributing resources to achieve certain social goals. In healthcare, libertarian justice emphasizes freedom of choice for both patients and providers. Patients should be free to choose their healthcare providers, treatment options, and insurance plans without undue restriction. Likewise, healthcare professionals should be free to practice medicine without excessive regulation, provided they respect informed consent and contractual obligations. From this perspective, justice is not achieved by guaranteeing equal access, but by ensuring that no one is forced to provide or receive care against their will. A central feature of libertarian justice is the market-based allocation of healthcare resources. Healthcare services are viewed as goods exchanged through voluntary transactions. Prices, competition, and consumer choice are expected to allocate resources efficiently. Supporters argue that market systems promote innovation, responsiveness, and respect for individual preferences. Patients, as consumers, exercise autonomy by deciding how much care they want and are willing to pay for. Libertarian justice also places strong emphasis on negative rights, the right to be free from interference rather than positive rights to receive certain goods or services. In healthcare, this means individuals have a right not to be harmed, deceived, or coerced, but not necessarily a right to healthcare provided by others. This distinction is ethically significant and often controversial, particularly in debates over universal healthcare and public funding. Libertarian justice raises important ethical tensions in healthcare. Critics argue that market-based systems can exacerbate inequality, leaving vulnerable populations without adequate access to care. They question whether healthcare, unlike other goods, should be subject to pure market logic, given its connection to human dignity and survival. Supporters respond that coercive redistribution violates individual liberty and undermines moral responsibility. They argue that justice does not require equal outcomes, only fair rules protecting freedom and consent. In practice, elements of libertarian justice appear in policies that prioritize private insurance, patient choice, and limited government intervention. Even in mixed healthcare systems, libertarian principles influence debates about regulation, taxation, and the role of the state. Understanding libertarian justice is essential for engaging thoughtfully with contemporary healthcare policy discussions, especially in pluralistic societies where different moral frameworks coexist. To conclude, libertarian justice offers a distinctive vision of fairness grounded in liberty, consent, and property rights. In healthcare ethics, it challenges us to consider the moral limits of redistribution and the value of individual choice, whether one ultimately accepts or rejects libertarian conclusions. The framework plays a critical role in shaping policy debates and ethical reasoning. Libertarian justice reminds us that freedom itself is a moral value, and any ethical healthcare system must grapple seriously with how that value is protected or constrained.